Hi, this is Nalla Nagarajulu Reddy. Today I have been teamed up with Jitesh Verma and Sai Saket to present the topic about information retrieval in healthcare. First, let me tell you information retrieval. What is information retrieval in healthcare? It is the of systematical accessing and utilizing vast quantities of health-related data to aid in decision-making, research, and patient care. The goal of IR in healthcare is to quickly retrieve relevant and accurate information from massive, diverse sources like electronic health records, medical research database, clinical trials, and diagnostic imaging. Information retrievals involves methods to locate and access specific data from large, often unstructured health information repositories. Sorry. The process is to support healthcare professionals, researchers, and policymakers in making informed decisions that improve patient care and health outcomes. Now let's discuss about the importance of information retrieval in healthcare. First one is the evidence-based decision making. Access to the latest research IR enables healthcare providers to quickly retrieve the latest research studies, clinical guidelines, and evidence-based best practices. This is essential as healthcare continuously evolves with new treatments, drugs, and producers regularly emerging. Improved patient care. When clinicals bases their decisions on the most current information, they offer treatments that align with the latest standards and avoid outdated practices. This not only improves the quality of care but also leads to the better patient outcome. Clinical decision support. IR integral to the clinical decision support system, which brings relevant information to the clinical attention in real time. For instance, this system might alert a doctor to recent research on a rare condition affecting their patients to provide comparative data on the treatment outcomes. Now let's talk about this knowledge management. Centralize the knowledge repositories. IR system helps organize and centralize the knowledge across the healthcare field. Medical knowledge, including research, finding procedure guidelines, and pharmaceutical information, is stored and made accessible through IR systems. This centralizes ensures the healthcare providers and researchers have access to the cohesive source of knowledge. Continuous learning and sharing. In a field as knowledge intense as healthcare, staying up to date is a challenge. IR system ensures healthcare professionals can efficiently locate new information and insights, facilitating continuously learning and knowledge sharing across hospitals, research institutions, and medical schools. Now let's talk about the personalized care. Patient-specific data retrieval. IR information technology makes it possible to retrieve and analyze data that unique to each patient, including the medical history, genetic profile, and lifestyle factors. This allows providers to develop personalized treatment plans that consider the individual characteristics and preferences of each patient. Tailored treatment practices. Personalized medicine is greatly enhanced by IR as it enables healthcare providers to match patient-specific data and treatment that have specific shown efficiently for similar profiles. For example, IR can retrieve data on which cancer treatment works best for patients with specific genetic mutations. Now let's talk about the operational efficiency. Automation of routine tasks. Effective IR systems streamlines routine tasks such as managing patient records, retrieving lab results, and accessing clinical guidelines. This automation frees up valuable time for healthcare providers to focus on direct patient care. Reduced information retrieval time. Fast access to critical information reduces delays in decision making and treatments, whether it's locating a patient previous test results or accessing research on a specific conditions. IR minimizes the time spent searching for information, which will be very useful to take fast decisions. Enhanced workflow integration. IR systems are often integrated into the electronic health records and other clinical workflows, ensuring that the essential information is accessible exactly when needed. For instance, an IR system can pull up relevant patient information and research at the start of a consultation, which supports a more efficient and seamless workflow. Now let's talk about the fundamental concepts of information retrieval. Information indexing. Information indexing is nothing about organizing data, use of natural language processing, machine learning. Now let's talk about the organizing data. Indexing is the process of structuring and organizing healthcare data to enable quick and efficient search that involves breakdown complex data such as electronic health records, research papers, and clinical notes into searchable units. Use of NLP. Techniques help extract meaning from unstructured data such as free text notes and medical documents. For example, NLP can identify a key term, conditions, and treatments mentioned in a doctor notes, transforming them into structured data that is easier to search. Machine learning for enhanced indexing. ML algorithms are employed to improve indexing by learning patterns in data such as identifying synonyms and related terms. Example, recognizing heart attack and myocardial infarction refer to the same condition. This enables more accurate and relevant search results as the system can better understand the relationship between the terms and concepts in healthcare. Now let's talk about this query formulation. Understanding user notes. Query formulation is an essential to ensure that the information retrieved aligns with the user intent. In healthcare, queries can range from simple symptom-based searches to complex research-driven questions, like finding studies on drug efficiency and specific population. Keyword selection. Efficient query formulation often starts with selecting the right keyword. For example, if a physician is searching for treatments related to type 2 diabetics using specific keyword like insulin resistance or glucose metabolism can improve search accuracy. Boolean operators and advanced ranking. Boolean operators like and or not and the syntax tools help refine searches by combining or excluding terms. For instances, a query like diabetics and hypertension, not pediatric, narrows down the result to study that involves adults with both diabetics and hypertension, excluding pediatric cases. This approaches is especially helpful in filtering large data sets for relevant specific information. Personalization and contextual queries. Modern IR systems also consider user preferences and past searches to make query formulation more intuitive, which is particularly helpful in healthcare where user needs can vary widely based on role. Example, doctor, researcher, and patient. Now let's talk about the relevance ranking. Algorithms for relevance ranking. Relevance ranking is the process of determining which search results are best match that user's query. Ranking algorithms prioritize data based on the factors such as term frequency, context of the search, and the authority of the source. For instances, studies published in high impact medical journal might rank higher in relevance when searching for clinical research. User preferences and feedback loops. Advanced IR systems use machine learning to adjust the ranking based on the user interactions such as clicks and time spent on the specific result over time. The system learns user preferences, refining relevance ranking to deliver increasingly accurate results. Personalized relevance. In personalized healthcare searches, relevance ranking may also consider patient specific factors such as age, medical history, or specific genetic markers to prioritize information that aligns with the healthcare patient needs. The rest of the topics will be seen by teammate Saket.
Hello. The search methodologies and techniques in IR for healthcare is the first one is key-based search, semantic search, and content-based retrieval. So when it comes to keyword-based search, it's the most traditional IR approach where specific keywords or phrases are matched against the database. This method is straightforward and efficient for retrieving information that directly involves the searching terms. But there is a limitation for the basic keyword search. Normally in healthcare, keyword searches can sometimes fall short due to variations in terminologies like heart attack and cardiac arrest, or and also difference in medical languages. This can lead to either missing results or irrelevant data. But there is an NLP enhancement in IR, where the new IR model systems uses NLP to improve Keyword based searches by recognizing synonyms, acronyms, and abbreviations. For instance, NLP can understand the word BP refers to blood pressure, and that HTN is normally known as hypertension. And semantic search, unlike keyword searches, which rely on exact term matches, semantic search aims to understand the intent and meaning behind the query. This approach leverages NLP and knowledge graphs to interpret complex medical queries, even when specific terms are not used in the search. Knowledge graphs in healthcare, knowledge graphs and are databases that stores interconnected medical concepts such as synonyms, symptoms, diseases, treatments together. For example, if a doctor search for a chest pain in diabetic patients, a semantic search system could use a knowledge graph that relate chest pain in conditions like cardiovascular diseases and retrieve relevant results, even if a search result does not contain chest pain. Improved relevance. Semantic search provides more relevant results by considering context. For instance, if a researcher searches for antibiotics, a semantic search system provides results related to the children over genetic antibiotics articles, delivering a more accurate answer to the query. When it comes to context-based retrieval, mm, the main goal of context-based retrieval beyond text matching to analyze the actual content within the documents, images, or other media. These approaches is especially useful in healthcare for handling clinical notes or radiology images, pattern recognition, and similarity analysis. Content-based retrieval identifies patterns and similarities within the documents or images to provide results to relevant query. For example, if a radiologist is searching for X-rays with characteristics of specific lung condition, a context-based retrieval information can analyze visual features in medical images to return similar cases. A few applications in imaging and radiology. In radiology, content-based retrieval can be used to match the new X-rays or MRIs with past cases, helping physicians identify similarities and make information more specific. In context-based IR, techniques can find relevant sequence supporting precision medication by linking genetic patterns to the specific disease or response to the treatments. Next slide. Okay. Now, information retrieval challenges in healthcare. There are like four: heterogeneity, privacy and security, terminology and ambiguity, and continuous innovation. When it comes to data heterogeneity, healthcare data is includes structured data, unstructured data, or even like graphs. Um, each type requires different IR approaches, making integrity more challenging. Uh, interpret interpretable challenging. Different healthcare systems often use varied standards and formats, complicating the challenges. For example, EHR systems may allow different coding standards like ICD-10, making it difficult to retrieve the analyzed data consistently across systems. Impact on patients' care. Data heterogeneity limits the ability to create the patient's record, potentially missing crucial insights or any past data. For healthcare, provides this can mean slower access to the information, impacting care delivery. When it comes to privacy and security, healthcare data is subjected to strict regulations like HIPAA in US and GDPR in Europe. which mandates secure handling of patients' information. Encryption and access control. Ensuring data privacy and security means implementing robust encryption and access controls, which can complicate relevant process. Data often needs to be anonymized or re-identified to protect patients' privacy. Yet, this can make relevance more complex for removing identifying details. There is also a risk for data breaches. Healthcare data breaches can expose sensitive patients' information, leading both financial and reputational damage for healthcare providers. IR systems must integrate advanced security measurements to these risks, such as multi-factor authentications and frequent audits. And terminology ambiguity. Healthcare terminology is highly specialized and includes thousands of medical terms, abbreviations. A single condition may have multiple synonyms, and abbreviations can vary widely across the database. Inconsistent terminology usage. Different healthcare providers may use varied terms to describe the same condition to produce, such as heart attack or myocardial infarction are synonyms, but yet different terms may be used for different records. Uh, Natural language processing limitations for the security. Through NLP helps process unstructured data, it still faces difficulties in medical terms. Certain terms may have multiple meanings depending on the context, such as PP for the blood pressure and boiling points. And continuous innovation. The healthcare industry is evolving rapidly with frequent updates to medical guidelines. New treatment methods and are emerging technologies. IR system must keep pace with these changes to remain relevant and efficient. Need for ongoing upgrades. As technology advances, the IR system requires continuous upgrades to stay compatibly with emerging data formats and standards. This includes regular updates to machine learning algorithms, NLP techniques, and security protocols too. Research and cost constraints. Upgrading and maintaining IR systems to adapt the innovation and the resource intensive requires ongoing investment in both technology and skilled personnel. This can be a challenging for healthcare organization operating under budget constraints, especially for smaller institutes. From here, our friend Jitesh would be continuing. Thank you.
So here I'm gonna speak out about the role of machine learning and AI in healthcare IR. First, coming to the intelligent search, contextual and intent-based searching is one of the method of intelligent search. AI-driven search algorithms go beyond keyword matching to understand the context and intent of user queries, making searches more accurate and relevant. For example, an intelligent search system can discern whether diabetes treatment refers to lifestyle management, medication, or new clinical trials based on the context provided in the query. Personalized search results. Intelligent search algorithms adapt to individual user preferences and roles to prioritize information that is most relevant to the user needs. This is especially valuable in healthcare where different professions may seek distinct insights from the same data. And coming to the second one, data analytics, pattern recognition, predictive analytics, population health insights, support for clinical decision making are 4 points in the data analytics. Coming to the first one, pattern recognition. ML models are skilled at recognizing patterns in large and complex data sets. In healthcare, they can identify trends in patient data, diseases progression, treatment responses, and other clinical factors that might otherwise go unnoticed. Predictive analytics. Machine learning driven predictive models are used to forecast health outcomes, such as predicting which patients are at risk for complications or readmissions. This helps healthcare providers make primitive actions, improving patient care and potentially reducing costs. Population health insights. ML in data analytics provides insights at the population level, uncovering trends related to public health, epidemiology, and disease outbreaks. Support for clinical decision making. By analyzing extensive data sets, machine learning models provide clinicians with evidence based recommendations and insights, enhancing clinical decision making. For example, data analytics can identify the most effective treatments for a particular condition by analyzing outcomes from past cases. And third, natural language processing, NLP. Interpretation of unstructured text is one of the main aspects of the NLP. NLP enables healthcare IR system to process and understand unstructured text data, such as clinical notes, pathology reports, and research articles. Second one, sentiment and context analysis. NLP can analyze sentiment and context in patient feedback, social media, and reviews, providing healthcare providers with a better understanding of patient experiences and concerns. This analysis helps in tailoring patient engagement and support. Facilitating voice-based searches. In healthcare settings, voice-based interference provided by NLP allow practitioners to retrieve information hands-free, which is especially helpful in fast-paced environments like operating rooms or during patient examinations. And the final, computer vision. Medical image analysis, pattern matching for diagnosis, integration with text-based IR, real-time monitoring and analysis of 4 key points of the computer vision, which are used using X-rays, MRIs, and CT scans. And coming to the next slide, here we have the ethical considerations in healthcare IR. And the few of them are privacy and confidentiality, bias and fairness, transparency and accountability. Coming to the privacy and confidentiality, the key issues are healthcare IR system often deal with sensitive personal data, and protecting this data is crucial. The best practices could be encryption, secure storage, and access controls are essential. Additionally, healthcare IR systems should be designed to ensure data where appropriate to prevent breaches of patient confidentiality. Bias and fairness. The key issues could be AI models used in healthcare IR may inherent biases from historical data, clinical practices, or data collection processes. And the best practices could be mitigating bias involves diversifying data sets, testing models for fairness, and ensuring that algorithms are trained on data that is representative of diverse populations. And the third point, transparency and accountability. The key issues could be healthcare stakeholders need to trust the decisions made by IR systems. Transparency in the design, development, and deployment of these systems is key to gaining their trust. Additionally, accountability measures ensure that the errors or harm caused by these systems can be tracked back to the responsible parties. And the best practices could be transparency. Transparency involves making the inner workings of algorithms understandable to non-experts, and accountability can be achieved by documenting decisions made by every stage of the system's use, including regular audits. And here are the future trends and innovations in healthcare IR. Multimodal integration, personalized recommendations, predictive analytics. So coming to the multimodal integration. Multimodal integration refers to combining different types of data such as text, images, genomic data, and sensor data into a unified framework for a comprehensive healthcare IR. By integrating diverse data sets, healthcare systems can provide a more holistic view of patient health, enabling precise diagnosis and tailored treatment plans. For instance, combining radiology images with clinical notes and genomic data allows for more accurate disease predictions and personalized treatments. The main challenges are ensuring the seamless integration and interoperability of different data types from disparate sources. Example, EHRs, lab results, imaging systems, while maintaining data integrity and security are the main. Coming to the personalized recommendations, key concept could be AI-driven systems will increasingly be used to provide personalized health recommendation based on an individual unique medical history, genetic profile, lifestyle, and environment factors. By analyzing large volumes of patient-specific data, AI can offer personalized treatment plans, preventive strategies, and tailored interventions, improving both patient outcomes and the efficiency of healthcare delivery. For example, personalized medicine based on genetic information can optimize drug prescriptions to minimize side effects and improve efficiency. And the third one, predictive analytics. Predictive analytics in healthcare uses historical data, statistical algorithms, and machine learning models to identify patterns, predict future health outcomes, and enable preventive care. By predicting disease progression, treatment efficiency, and patient outcomes, predictive analytics can help healthcare providers make more informed decisions, identify high risk patients, and intervene earlier. For instance, predicting the likelihood of hospital redemption, developing chronic diseases, or detecting sepsis from before it occurs can significantly reduce healthcare costs and improve patient outcomes. While predictive models have great potential, ensuring their accuracy and generalizability across diverse populations is crucial and is critical to handle all the things. Over reliance on predictive analytics could also result in overlooking individualized nuisances and unanticipated complications. So, coming to the conclusion, the future of healthcare IR is evolving towards a more integrated, data driven approach that combines multimodal data, personalizes care, and leverages predictive analytics to enable proactive healthcare strategies. These innovations hold great promise for improving patient outcomes, optimizing healthcare delivery, and making the entire system more efficient. However, they also bring challenges in terms of data privacy, ethical considerations, and ensuring equity in access to advanced healthcare technologies. So, here we end up our presentation with the team members Nalla Nagarajulu, Jitesh Verma, and Sai Saket. Thank you so much.